We've gathered tonight at Johnson & Wales University's Down City campus in Providence to get to the truth of the opioid epidemic and its impact on families here in southern New England. Thank you so much for joining us tonight for this ABC6 News special presentation, The Opioid Crisis, Addiction Hitting Home. I'm Christina Myers.
And I'm John DeLuca. So glad you could join us as well. We're joined tonight by Joe Paolino, the host of In the Arena, political affairs show on ABC6. Joe, welcome.
It's great to be here. Tonight, we're speaking with a team of people directly affected by this crisis, from doctors in law enforcement to parents and those in recovery. And
they will all be serving on our panel tonight. Audience members who are here this evening, as well as our ABC6 viewers, will have a chance to ask questions and spark discussion about the crisis and what we need to do to tackle it.
And we want to begin tonight by taking a look at this crisis and the impact that it's having on families. ABC6 News anchor Liz Tufts met up with a Cranston mother who is now reaching out to students after losing her son to addiction.
This can affect any home. It can enter any home. I never thought it would enter mine, but it did.
Heroin first entered Deborah Parenti's life in 2010 when her son Peter was 20 years old.
It started with the Vicodin when he was at Rhode Island College. He went to a party and he really wasn't much of a drinker and he didn't even really smoke marijuana. But someone had offered him some Vicodin and unfortunately he took them. And from there, when they became, too hard to find and too expensive, he turned to heroin.
At first, Deborah didn't see the warning signs.
The reason why I didn't pick up on it is because my son was a functioning addict.
But as the years passed, she started noticing a change in her son's behavior. But by that time, it was too late.
Life as I knew it changed.
In November of 2015, when Peter was 25, he overdosed at work.
Brought me back to see him, and he was on life support. And he had suffered a heart attack. His brain had collapsed, and he would not survive.
The last 2 years have been brutal for Deborah.
I just wake up every day and try to live with a broken heart.
But instead of crawling into a hole, she's decided to do something about it.
People are losing children everywhere. It doesn't matter where you live. It doesn't matter what color you are. It doesn't matter how much money you have or you don't have.
She's teamed up with the U.S. Attorney's Office, visiting schools all over the state, sharing her son's story.
We have spoken to 10,000 kids across the state of Rhode Island.
For her, stepping into schools is helping her cope.
I truly believe that at least one leaves that auditorium, and I know that it has an impact on them.
A mother now on a mission to save lives with the help of her son.
If he had the choice, he would have never chose to become an addict. My son wants to speak, and I will be his voice.
Liz Tufts, ABC6 News.
Thank you, Liz. We're joined now by our parent panelists. We'd like to introduce them, beginning with Deborah Parenti from the Rhode Island Family Task Force. She lost her son, as we just saw, Peter, to addiction. Lori McDougall, co-founder of Resources, Education, and Support Together, REST. She's also the mother of a recovering addict. Carl Dye, whose 21-year-old son entered treatment just last week. And Paul Kandarian, the father of a veteran and recovering addict who we'll be seeing on our panel later this evening. Moms and dads, parents, we want to thank you for joining us tonight and thank you for taking the time to speak with us on this incredibly important topic. Deborah, we'll begin with you. As we just saw in your story with Liz, here you are going across the state, meeting with countless numbers of students. In any way, does that help in the grieving process?
Absolutely. When my son first passed, I said to myself, you have two choices. You can either just crawl up in a ball or you can try to help educate and prevent this from happening to someone else's child. So when I go in, the feedback that I get from these kids when I go.
Deborah? What do you hear from them?
They just say, thank you for sharing your story, and I'll remember you, I'll remember your son. I beg them to think twice before ever making that choice and ever going down that road. And the feedback is phenomenal that we get from these kids.
Has anyone opened up to you and said that I am using, or I'm going to get help, or I know someone who is?
Yes, they have. Yes.
What did you tell them?
I just told them that there are plenty of resources throughout the state. The state of Rhode Island has done a phenomenal job on educating students, parents, across the state, and we give them all, numbers and information and pamphlets on where they can call to get help.
Lori, what would you say to moms and dads who are watching tonight about how to have conversations if maybe they think something's not right? Mother's intuition, a gut feeling, something?
I would say pay attention to it. I think I did have that gut feeling, and I did have a slight pang in my brain and in my thought process, and I didn't go digging. I stayed naive. I thought those incredibly naive thoughts that a parent has, that this was just a phase that he was going through, and it smacked me right in the face when I found out that he was struggling with substance use disorder, and I too found him overdosed in my house. So I would tell parents to listen to your heart and listen to your brain, and try and access as much information out there that you can to try and get help.
Lori, when you say going through a phase, give me an example of what you're talking about. What was he doing? What was the behavior?
Well, I thought in high school, I thought he was experimenting with maybe alcohol and pot, and I didn't think it went any further than that. And I thought, oh, it's a phase. He's going to grow out of it. He's going to go off to college, and he's going to wake up and know that he can't continue to do this. Just really kind of naive thoughts as a parent.
Wishful thinking, maybe?
Yeah, wishful thinking, and I would say naive is really the, I thought that my husband and I had both experimented when we were young, and I thought it would be the same for my children, and it turns out it wasn't.
Carl, just last week, your 21-year-old son, what's his name? Nathaniel, entered into Amos House for treatment. What prompted that? What led up to that moment?
He called me and told me he was struggling. And at first I took him to some 12-step meetings, but then he stopped going. But I had to let him go. I couldn't force him to go. And then eventually he called me when he was ready, to go into treatment. I was there for him, whatever it takes, because I know I struggled for 30 years. So I know.
You struggle with addiction?
Yes. So I know what it's like.
You want to get your child help. You want to take them to treatment.
Whatever it
But
takes.
if they don't want it, can it work?
In
your experience?
No. No, you have to be ready, because I struggled for a while until I finally surrendered and I had enough, so right now I'm just trying to be an example, to show him that he can live a good life, because I got a good job now, I'm working, I'm doing the things that everyone does, normal people.
What is he saying to you? Does he have any hope, or is he?
Yes, he has hope. He called me and asked me to come get him today, so.
For what, because things are going well, or because he wants out?
No, he want to go to a meeting today. So I told him I'd be there to pick him up after this.
Did you tell him you're doing this tonight?
Yes.
What did he say?
Don't be nervous. I sing in front of hundreds of people. So he told me not to be nervous.
Good advice.
Yes.
Good advice. Paul, your son, who we're going to meet later on, who Christina did a fantastic story with, incredibly compelling story. Would you tell parents out there that there's hope, or because they feel despair right now if their child's going through addiction? What would you tell them in terms of it's not over, there is hope?
There's a lot of tragedy, there's a lot of loss, as we know, and you have to report that. You have to look at that, because it's not going to go away without shining a light on it. But there is hope. If they want help, they have to really, really want it. It took him a few tries. The system wasn't working for him, and then we finally got him to the VA. And as much maligned as the VA is, they had some people there step up big time. Lynn Dion is one at the VA, and they got him help, and he wanted help, and he overcame it. But they have to find that inner strength, as you know. They have to find the courage, the guts to do it. If you can get them to point them in the right direction, and as a parent, that's the best you can do.
When you first started seeing Paul go through the initial aspect of using drugs, What did you think?
Again, as Lori was saying, that it's the head and the heart. Your parent's heart doesn't want to know. You know, you're in denial. You think maybe same thing. Maybe it's a phase. You know, maybe he's just doing a little this, a little that. So, but you have to use your head. You have to be objective about it and see the signs. And I saw them, but I just didn't want to know what they were until it got worse and it got worse, and he got arrested a couple of times. And then I realized he was going down the path that was going to end up in jail or dead. And he had some very bad infections in his arm, and that's when we went to the VA. So yeah, I had my head in the sand for a long time, and I'm not proud of that. You know, you have to confront them if you know what's going on, or you think you know what's going on. But get help in that regard too, because you just can't charge in there and say, what are you doing, because you're just going to send them the other way. There's diplomatic ways to confront your child, and there's avenues out there to do that, and I wish I'd thought of that back then. But luckily, he got clean.
There may be a mom or dad watching this. In fact, I would bet anything there is. And they say, I know exactly what you're talking about. If you had it to do over again, obviously you would have said something back then. What would you tell that parent right now? Don't wait?
Don't wait, yeah.
Find out how to talk to your son or daughter
find
first?
Out. Ask the experts, ask a doctor, ask somebody, or follow your heart. Just follow what your heart is telling you to do. You raised a child, you know them better than anybody. So just figure out how you've always talked to your kids, and talk to them in a non-threatening way and kind of a gentle way. But
it's such an emotional topic, though.
Yeah,
I mean, that's just...
It's impossible not to be, because, God, we had so many fights over it, you know, confrontations and screaming matches, and that's not the way to do it either. So you have to be diplomatic, you have to be judicious about how you approach them, because if you come on too strong, you're going to just send them in the direction you don't want
They
them.
close off and don't want to hear it.
Exactly, yeah, they get very, very defensive.
We'll end it there. Thank you, Paul, Carl, Lori, Deborah. Thank you so much again for your courage and taking the time to share your stories with us tonight. We're going to take a quick break and recognize our supporters. And when we return, we'll welcome our first panel, and our audience will get a chance to ask questions as well. We'll be right back.
Hi, I'm Mike Rizzi.
And I'm Wendy Looker, and we're from the Opioid Treatment Association of Rhode Island.
Our association is the largest provider of medication-assisted treatment for opioid dependence in the state, currently serving 15 locations.
We provide treatment to 5,000 individuals on a daily basis.
Our programs are certified, accredited, and licensed by the Center for Substance Abuse Treatment.
The best prevention for opioid overdose is opioid treatment. We've been preventing overdose and saving lives since 1974.
Addiction is such a hard disease, and people just don't understand how it can get into families. I lost 2 sons to overdose. For the person that is using, and they think that they're all alone, they're really not. There is so much more to life than this addiction. Don't be afraid to reach out, because the people that love you will be there for you. There's so much support.
I'm Dr. Sarah Becker. At the New England ATTC, we support professionals out in the field to ensure that patients with substance use disorders receive the best quality care possible. The goal of the ATTC network is to support the workforce that treats individuals affected by substance use disorders. Not all treatments for addiction are created equal. Our ATTC addresses this problem by helping to train providers in those treatments that we know work best.
Moving on now to the town hall portion of the evening. This is our chance to really dig into the issues and learn from those folks who are on the front lines fighting the opioid epidemic.
And here's how we're going to tackle tonight's discussion. The night will be broken up into 4 different categories. One of them focused on the problem and its scope, another on the challenges facing police and first responders. We'll also spend a lot of time tonight talking about treatment and recovery, as well as research and prevention. We'll welcome new panelists as the conversation progresses throughout the night.
First, we're going to try to get a better sense of the problem. ABC 6 News reporter Chloe Leshner visited a treatment center, and it was so inundated. They're being forced to change the way they operate just to meet the demand. Here's her report.
There's a high demand for addiction treatment in Fall River. Just shy of 1,000 patients sat in this waiting room from July to September 2017, but only 1 in 5 patients will get a detox bed.
Every day we're having to make a Sophie's choice about who gets a bed and is safe and who we have to say come back tomorrow. And some people don't get to come back tomorrow.
Nancy Paul has been helping addicts at the Stanley Street Treatment and Resource Center for 40 years. She says in all that time, she's never seen anything like what they've been experiencing the past few years. From 2000 to 2016, more than 1,600 people in Bristol County died of an overdose.
We have had to re-engineer the way we do business in order to meet the needs of the clients we serve.
They operate a triage center. Every person is seen by a social worker, nurse, and recovery coach before they're placed into the type of care they need. Overdose deaths in Fall River are finally on a slight decline, and the workers at STAR are heartened by the fact that more of the patients they're seeing are coming back for follow-up treatment.
Our model of being there when a patient needs us is revolutionary.
Still, they have to make that Sophie's choice, turning away addicts simply because the demand is too high. That's why they've started plans on a new $12 million, 60-bed facility.
I couldn't build a building big enough to solve the problem, but it certainly will help get more people into care.
Paul says there's no real way to measure STAR's success rate, but that the key to recovery is getting people into treatment earlier. In the newsroom, Chloe Leschner, ABC 6 News.
We wanted to give you some statistics on overdoses in Rhode Island. From 2011 to 2016, overdose deaths in the state rose more than 90%. There were just over 300 overdose deaths in 2017, which is down a little from 2016. Still, a long way to go for both Rhode Island and Massachusetts. John, back to you.
Thank you, Christina. Those are certainly staggering numbers. We're joined now by our next group of panelists. I'd like to introduce them individually. We'll begin with Dr. McDonald from the Rhode Island Department of Health. Next to him, Captain Matthew Moynihan from the Rhode Island State Police. Next to Captain Moynihan, State Senator Joshua Miller, member of the Governor's Task Force. Caroline Parenti, South Kingstown Partnership for Prevention. And Tom Coderre, Senior Advisor to Governor Raimondo, who is leading the state's effort to combat the addiction crisis. Thank you so much for joining us tonight. We really do appreciate your time. This incredibly important topic. Dr. McDonald, I want to start with you. Just a sense for folks who don't know, what are these drugs and how are they getting into the hands of young people?
So really it's the potency that's driving the lethality of the epidemic and the prevalence of the epidemic. You know, in 2011, heroin was pretty common in Rhode Island. Now in 2018, it's fentanyl. Fentanyl and its analogs, chemicals like it, are much more potent than heroin. And that's what's driving the epidemic. It drives people overdosing, and it drives the fatal overdoses. And although fentanyl is not a household name, if you're using an illicit opioid today, you should assume what you're using has fentanyl in it. And fentanyl is much more potent. And since it's more potent, people get a dose much higher than what they expected. They overdose. Overdose means they stop breathing, and if they stop breathing long enough, their heart stops.
How much more potent is it, doctor, than heroin? How much more potent is fentanyl than just heroin?
So fentanyl is 50 to 100 times more potent than morphine, and 100 more times more potent than heroin. And I said morphine and heroin on purpose in the same sentence, because a lot of people don't remember this, but heroin used to be a drug. In 1898, it was sold for cough. And so the generic name of heroin, diacetylmorphine, sounds a lot like morphine for a reason. So heroin is just a cousin to morphine.
Christina is joining us now from the social media desk with a question. Christina, what do you have?
John, leading up to this town hall special, we've been collecting questions from our viewers on social media, on our Facebook page, our Twitter page, and on our website. Now we want to get to some of those questions. This first one comes from Dan Bashirs from Halifax, Massachusetts. He writes, recently my 11-year-old son was given a prescription for Vicodin because of a damaged tooth. What role does overdose of prescription narcotics play in the opioid abuse epidemic?
We'll give that question again to Dr. McDonald. 11-year-olds getting prescribed opioids.
Yeah, regrettably, John, that's how a lot of people get started in this. A prescription opioid like Percocet or Vicodin are very common. But if you're genetically predisposed to having the chronic disease, opiate use disorder, a trigger goes off within their brain, and that signals that person to really want that opioid or any opioid like it. You heard that story, regrettably, from Mrs. Parenti earlier. She talked about her son Peter in that regard. But often how people get involved with getting to illicit opioids is through a very banal experience of going to a physician or a dentist and having a healthcare procedure done. And so they got a prescription. They thought it was safe. And regrettably, that's how a lot of people discover they've got a problem. And so prescriptions really lead people into this problem.
Tom, I wanted to direct this next question towards you. We heard Christina read the numbers of overdose deaths. The numbers are coming down, but even in 2016, over 300 people, one is too many. We're making progress. What's being done at the state level?
Sure. So shortly after coming into office in 2015, Governor Raimondo established an overdose task force through executive order, and the task force went to work immediately developing a strategic plan. A lot of the efforts that you've seen over the past 2 years have been a direct result of the strategic plan and the task force members coming together and working on this problem as a community. They identified 4 main tasks: prevention, treatment, rescue, and recovery, and they've gone to work very, very diligently to make those, to really build out those 4 tasks into work groups, and have had extremely positive results. We've just heard that the numbers for 2017 are in, and we've had an 8% decrease in overdose deaths 2016 over 2017.
Caroline, I wanted to ask you, you're with the South Kingstown Partnership for Prevention. What do you think when you hear all these numbers from your reaction dealing with students?
My reaction is that it's astounding to know how many people this is actually affecting, because in the schools it's not as prevalent, the opioid epidemic, but I think when we actually hear the numbers and we actually hear how serious it is, it's kind of an awakening. We see how big this problem actually is.
What do your friends say? Like, oh, that'll never happen to me, or I know somebody who's going through that, or I know a family, or my brother, or my mother, or my whatever. What do you hear from your peers?
Exactly. There's a stigma to who actually gets addicted, and I think we need to try and break the stigma and show that addiction can hit anyone.
All right. Thank you, Carol. I'm going to pause right there and bring on our next topic, which is talking about the first responders and what police and firefighters deal with on a regular basis. A few Fridays ago, I had a chance, a photographer, to go out with the captain of the Providence Fire Department named David Palumbo. He and his partner were kind enough to take us along on the rescue on a Friday night. And believe me when I tell you, it was an eye-opening experience.
50-year-old female is saying she has no pulse and she's not breathing.
It's Friday night in downtown Providence. Captain David Palumbo and his partner raced to reach a woman who is not breathing outside of a hotel on Atwells Ave. Chest compressions, oxygen, Narcan, all used. Despite their best efforts on a bitter, cold, blustery night, none are able to revive her. Captain Palumbo has been on the job for over 25 years in Providence. He says the last 2 have been the worst he's seen for opioid overdoses.
They're doing stronger drugs. They're lacing the heroin with fentanyl and other type drugs. And sometimes I don't think they even know themselves what they're doing.
While we do not have an official cause of death for this woman, an overdose cannot be ruled out.
I think there's a misconception about who these people are that are overdosing. Like, it's those people. Like, who are you seeing? Like, give me what are we talking about?
Basically, it's the common household. It's, I hate to say it could be a school teacher, it could be a working class man. This drug has no boundaries.
Captain Palumbo estimates he's administered Narcan over 1,000 times, and when given in time, he says you see a person go from death to on their feet within 2 minutes.
Within 30 seconds to a minute, you see a reaction of them start, they could be blue, and then once you get that Narcan, you can see them starting to come around and have some angle breathing, then they stop breathing, and it's that quick. It really is.
Did you ever revive someone and they were mad that you revived them?
Yes. The worst one I ever had was I had a guy in his house and he had his kids there and he was basically dying in front of me, and we went to give the Narcan, and with his hand and every bit of strength he was blocking me from giving it. He'd rather take the chance of, he didn't want to lose his high, he'd rather die than me give Narcan and save his life, and his 2 kids are right there watching the whole thing.
What did you learn from that experience?
That this drug totally takes over your mind control, and there's no boundary of what people would do not to get their high.
To that point, you'd think near-death experiences would stop people from using. It doesn't.
There's a lot of repeat customers here that keep doing the same thing over and over again, and sooner or later it's going to get them.
Have you revived the same person more than once, or some of the guys here?
We've revived the same person probably 20 or 30 times. Every time people do it, they're rolling the dice with their life, and that's a dangerous proposition.
There are so many aspects to fighting the opioid crisis, but arguably none are more important than the first responders racing to save overdose victims. One of those first responders is joining us tonight from the State Police, Captain Moynihan, who we met earlier. I want to if you could give folks a perspective as to what you see. You get the call, somebody's passed out on the side of the road, trooper pulls up, encounters somebody that maybe there's a needle hanging out of their arm, or it's an obvious overdose victim. What do you do?
Sure. John, let me first start by thanking you and ABC6 for involving the state police tonight in this discussion. It's a very serious issue that we're all involved in. And from the law enforcement perspective, it is very it is great to see the passion and the outpouring that comes out and the dedication by those that are involved in trying to combat this issue. Narcan, as you saw in your report in the ride-along, accurately depicts what occurs day in and day out, unfortunately, on our streets of Rhode Island. Our troopers and our first responders, law enforcement, are frequently out there and in the front line of this battle against the opioid epidemic. Roughly 4 years ago, we initiated a new program where we're equipping all law enforcement in the state with naloxone.
Do you ever think you'd see that day? You guys should be carrying something like that to revive people who have overdosed?
You know, Johnny, it's an interesting point. Is originally 4 years ago when that was brought to light, there was some negative reaction from the law enforcement community. I think now, 4 years later, and seeing the scope of the problem and how much of the opioid epidemic has touched families, touched everyone, that now it's become a life-saving tool, and a tool that law enforcement uses and relies on to save lives.
And briefly, before we get to Christina, how dangerous, and we know how dangerous fentanyl is, and carfentanil, which maybe Dr. McDonald can talk about, but the officers, the troopers, have to be careful not to get it on them. There was a Warwick police officer who encountered something like that, just a few little granules of it. What precautions do you take to try to protect yourself? And protect
Absolutely. And the dangers with this epidemic and this problem is the unknown. As the doctor had pointed out, when addicts are using and they're buying street-level heroin, which is frequently laced with fentanyl, and now we're even seeing occasions with carfentanil, the potency is at a level that they're not used to. And from the first responders' perspective, the same applies. We need to use universal precautions and gloves and be very careful of substances that we come in contact with, and make sure that there's awareness out there of the dangers, and when signs are there of overdoses, you know, have that Narcan, naloxone on hand, and quickly administer it to reverse the effects.
Right. And I also want to make mention, I don't know where my manners are, didn't introduce our two new panelists, Jonathan Goyer. Jonathan manages Anchor More, an outreach program, and is a recovering addict. Jonathan, thank you for joining us. And also Ellen LaPlante from the South Kingstown Partnership Prevention, who's also a student. Jonathan and Ellen, thank you for joining us tonight. We'll engage you in the discussion in just a moment, but I wanted to make sure I introduced you to the panel. Christina.
John, our next social media question comes from Mary Cano, who's from Fall River. And first of all, she wants to thank all police officers and firefighters who are dealing with this crisis. And I know, John, you touched on this in your story. Also, some of the panelists have touched on some things. But she wants to know, what are some of the biggest challenges facing first responders, again, in this crisis?
Captain Moynihan, how would you tell somebody the biggest challenges we face?
Well, Mary, thank you for your question. I think the challenges from the law enforcement perspective are the same that we're all facing in battling this epidemic, whether it's from the medical profession or the recovery stage. And I think in looking at it, I think we can all see that it wasn't one group or system that created the problem, and it's not going to take one group or system to correct or provide a solution. I think the answer is working together, and I think the initiatives that have been started in the state, in Rhode Island, is on the right course, where you're bringing the medical profession and you're bringing the mental health aspect along with law enforcement. But more needs to be done with it. We need to partner with the business community.
When I asked Senator Miller about that, it's not just a question of throwing money at this. There's got to be a coordinated effort, as the captain said, at the state level, and Tom sort of touched on this. But from what you're seeing, what's working, and you say, you know what, we got to keep putting money towards this. We're seeing results.
What's working is there's a series of efforts that we've been involved in, and some of them took legislation and some of them didn't. And what's working is a lot of the initiatives we put in gliding people to treatment. And part of that is what the first responder sees is he sees somebody who's overdosed. And he sees somebody who's overdosed sometimes several times. And why is that person overdosed several times? It's because there's been a gap in his road to treatment and then recovery. And so one of the things we tried to legislate is to make, to fix some of those gaps. Like one of the first pieces of legislation we did was legislation around emergency rooms and why were people coming into emergency rooms 4, 5, 6, 7, 8 times. And so we did legislation that looked at adding recovery coaches and adding quicker access to treatment and detox from the emergency rooms because they were traditionally set up not to deal with this problem, but to deal with broken legs, heart attacks, and other things.
It's a whole nother set of...
Yeah, so trying to make them more effective is one of the things we first tried to do. And it's complicated, and it's not solved, you know, in one day or two pieces of legislation or by one person. That's why the task force is 30 people and not like 3 or 4 people, because it's a really complicated problem, and there's a lot of things that have to be fixed in order to make it work better. And I think you would have seen a lot more progress, and we talked about fentanyl a lot, if fentanyl hadn't kind of interrupted our progress.
Thank you, Senator. Joe Paolino has a question with an audience member.
Nicholas, I can see you're anxious back here. What would you like to ask?
Yes, my name's Nicholas. Just wondering how easy it actually is to administer Narcan, and if you could just elaborate on the process of doing so.
Dr. McDonald?
Hey, administering Narcan is actually phenomenally easy. You can actually get it from almost any pharmacy in Rhode Island right now, even without a prescription. You walk in there, ask for it, it should be covered by your third-party payer. I recommend the nasal form of it because you can just get it in a 2-dose container, and then it really is at one pump in the nose. And everybody knows where the nose is. And you just literally spritz it in someone's nose. You really just can't get any easier than that. And so Rhode Island really has that available to folks. And I encourage anyone, if you don't have Narcan in your house, you're far more likely to come around someone who's overdosed than you are someone who's had a cardiac arrest. You know, we've all learned CPR.
Or does that say the sign of the times or what?
I think it is a sign of the times. And it really gets to that issue of like, we really need to be prepared as a citizen, as a family member, as anyone who lives in this area is, have your Narcan on you. Have it around for you so you can be available to help somebody. Narcan saves lives.
Ellen, I wanted to ask you, as you're sitting here listening to all this, A, what do you think? And B, why did you get involved?
I got involved because I saw my peers buying opioids from one another and getting involved.
You saw your
in,
peers buying opioids? Like prescription drugs?
Adderall and like Vicodin and painkillers that you would get from a surgery, something from high schoolers would have access to. And I just saw like a problem that I didn't want to be a part of, and I know I could do something to help other people, which is really why I got involved. And our coalition's put a lot of initiatives out there to help prevent it more with a Counter Lock It, Drop It campaign, which you can bring opioids prescription drugs that you're done using to the police stations. They have them everywhere in Rhode Island right now, where you can bring it and it will get rid of it so people in your household or people that would enter your household couldn't access
People
that
forget
anymore.
about it. They have it on a shelf and they're like, oh, I had that 3 years ago and I hurt my ankle.
Yeah, so they can't, it won't get distributed any farther than the person that was prescribed for. So when you're done with it, you don't have to worry about it anymore.
And how old are you?
I'm 16.
Thank you for getting involved. You saw something, you wanted to do something about it. Rather than just pointing your finger and being judgmental about it, you said, I want to do something. That's fantastic.
Thank you.
We're going to shift gears right now and talk about treatment and recovery efforts. And Christina, I understand you have a report you'd like to share with us.
Yes, John, I recently had the opportunity to sit down with an Army veteran from Taunton for a very raw and real conversation about his battle with addiction. We also talked about his recovery and how he's now turning his struggles around to help others. With his dyed red hair, tattoos, and band t-shirt, Paul Kandarian may not be your typical image of an Army veteran, and that's okay with him.
I didn't join for like my country or the freedom. I joined because working class kids like me were dying. I didn't have anything to live for. Why should they die when I can? And it won't impact the world, which is kind of a weird thing to say now.
When Paul joined the Army at the end of 2009, he was fresh off a 2-week detox from a whole mix of opioids.
After those 2 weeks were up, I march down to the recruiting station, and just like I want the infantry.
Despite the horrible things he saw in Afghanistan, 3 friends were killed, multiple others lost limbs. Paul's time in the Army was a bright spot when it came to his addiction. When he came home, it was a different story.
I hated the world. I hated civilians. I hated being home.
He quickly returned to the only way he knew how to deal with his pain: opioids. To fund his habit, he stole from his jobs and even his family.
Breaking into my grandparents' home, it's disgusting. I mean, my grandfather was my hero, and I loved him to death, but it was a way to get money, and I did it.
Paul's father brought him to the Providence VA hospital with massive infections in his injection sites. This time, he was ready for help and accepted it from nurse Lynn Dion, a woman he now calls his savior.
She saved my life. She's, a huge reason why I'm where I am today.
I was a piece of many things that helped to save you. You were the person who saved you.
Lynn says that's a key piece to an addict's recovery. They have to be ready to help themselves and have a goal.
I'm shooting for my doctorate. I have my own place. I have money in the bank. I have friends. I'm living life again, and it's just, I feel feelings like a human is supposed to feel. And I hadn't had that. I hadn't had that in years.
Once he had those goals, Paul was able to turn things that used to push him towards drugs into something that keeps him away from them.
Every day, I thought about Contreras, Tobin, Jeffries, Contreras, Tobin, Jeffries.
With their names on his brain and tattooed on his arm, Paul's friends who lost their lives in battle are now keeping him moving forward in his own battle with addiction.
My friends died for me, and I'm not going to use them as an excuse to ruin my life. I am going to use them as motivation.
And he hopes to motivate others as well.
My message to addicts is you can do it. It's not over. It's never over.
And Paul now speaks about his addiction and recovery to help others who are struggling. Perfect example. We're honored to have him be a part of our panel this evening.
Yes, Paul, thank you for joining us so much. Paul's here. We also want to bring in Dr. James Sullivan, Senior Vice President and Chief Medical Officer of Butler Hospital. Dr. Sullivan, thank you so much for joining us as well. We've switched out a few more panelists, and we'll continue our discussion now on treatment and recovery. Dr. Sullivan, for folks at home who don't understand, how does the treatment process start? I want help. I see this show on ABC6. I see Paul's story. I see Jonathan's story. I want to do something about it, but I get in touch with a medical professional. What happens from there?
So first of all, it's really important for listeners to understand that there is medical treatment available for these medical conditions. Substance use disorder is not a moral issue. Substance use disorder is a medical illness that really demands treatment for the initial stages of recovery. There are many avenues to treatment. Certainly there is the hospital level of treatment if patients really require that level of treatment for detoxification, for rescue, as it were, from their opiate addiction. There are also other avenues through your primary care physician to start talking to any professional that you have the opportunity to about your struggle with addiction and the request to find the way for the next best step for you.
Before we go to Christina, Jonathan, I wanted to ask you, what prompted you to go to seek recovery or to seek help? And then how was your recovery?
Well, I can start that by saying that I'm happy to be here. And I'm here because ABC6 News invited me, but I'm really actually here because a first responder saved my life with Narcan. So all the first responders out there and everybody that's going to the pharmacy to get Narcan, I want to personally thank you because 5 years ago, that I wouldn't have been able to do something like this.
Did you want help back then? Would that version of you wanted the help?
So I struggled with opiates for 10 years, and I can guarantee you that anybody who does struggle with drugs, there are moments in time where they do want help. Unfortunately, we can't determine when those moments are. I call them windows of willingness. So over the span of 10 years of using heroin, sure, there were absolutely times that I wanted to get help.
And very briefly, your recovery? How was the recovery process for you? Did it take a long time? Did it take more than one effort, one attempt?
So I've been to detox not once, not twice, but 38 times. And I am an overdose survivor. And that's sort of the thing, right? Where we never know when somebody's going to get it. quote unquote. So I'm
38 times.
38 times in detox, absolutely. So, and that speaks to what we need to do though as a community, right? Where first responders, healthcare professionals, where we see somebody, then we see the same thing over and over, the same person, but we can't give up on them because as my story illustrates that one of these times they're prone to get it.
All right, well said. Let's check in now with Christina, who has a question from social media. Christina.
John, this next question comes to us through our email. This one comes from Megan Bernal, who's from Johnston. She asks, what kind of plans are being made to make outpatient programs more approachable and affordable so that people don't feel like their only option is stuff on the street, like heroin?
That's a good question. Dr. Sullivan?
So on the heels of the governor's task force, there have now been established 10 what we refer to as Center of Excellence programs, which really speak to after the initial stages of detoxification, that an individual can receive long-term treatment up to 6 months or a greater period of time if needed. So the efforts are really pointed to that exact outpatient treatment that so many people are looking for right now.
So the stigma is still there, that some people, they haven't gotten to Jonathan's point, and they're like, well, I could get help, I don't want to get, I'm not sure. How do you get past that?
So for people who are really struggling with the illness, they have a change in their brain chemistry. So the brain itself is affected by the use of opiates. The part of the brain that controls behavioral control, decision-making, the 38 times decision-making about what the best thing to do is. Common logic is affected by the use of these drugs. So the stigma plays into it in terms of, I don't want to be judged. I might be full of shame. So I think that we have to educate and give absolute permission to anyone who has this struggle.
Well said, Doctor. Joe has a question from an audience member.
We have another question here in the front row. Please state your name.
My name is Linda Hurley. I work with Kodak Behavioral Health Care. I'm the CEO there. And my question for you is, on Friday, I was interviewed, and the journalist who interviewed me, her major question was, why is there such a long wait for individuals to get care in the community for opioid use disorder? And I was pretty much astounded by that. So my question to Dr. Sullivan, Dr. McDonald, is there really still appears to be a misperception in the community, which I think was echoed in the email question that we just heard. Could you speak to this? Like, what is the availability of treatment? Can you speak to knowing that where there are wait lists and where there are not? I think that's important for the audience and for the viewers. Thank you.
Tom, is that something you could discuss?
Yeah, well, I can certainly discuss it, and as can the doctors who are here. There are the treatment is available for folks who need it. We just recently saw the Safe Station project to open up.
Fire stations.
Fire stations, where you can present yourself in any fire station in Providence if you're looking for help, and within 15 minutes a recovery coach will show up and help you navigate the system. I think it's an issue of navigation. I think the resources are available. Finding the right level of care for somebody and helping them navigate the system, I think, are the big misperceptions that you have out there in the community. So please don't be fooled by the misnomer that treatment is not available. You just have to go after it and seek it.
Dr. Sullivan?
I agree with Tom that speaking for Butler Hospital, we have 24/7 services for both call-ins, for triage advice remotely and also on site, to be able to have those important initial conversations with patients and their families about what is required for immediate treatment, or in some cases, if the hospital level of care isn't needed, to be able to provide next day appointments. We have 7-day availability for people who need help.
We also have an overdose hotline that folks can call, where if they're looking for help, they can dial 401-942-STOP, and they can have access to somebody on the phone, real time, who can talk them through the process of how to get help.
All right. Christina, you have another question?
John, Laura Colasante from Charlestown asked us this question via Facebook. She wants to know, what are the symptoms of withdrawal?
How would you describe it?
It's hell.
I mean, the 2 weeks before the Army, I signed up for the Army. I detoxed myself in my room. Like Josh, I was in and out of detoxes, just didn't stick. And I just had enough, and I decided to do it myself. And like you said, it was sweating, diarrhea, vomiting, cramps to the point where I passed out, hallucinations, hearing things. It just, every nerve in my body was just on fire. I mean, I slept probably 4 hours in a week. Yeah, I wanted to die. It felt like a death that never would come.
What were you thinking while all this is going on, though, Paul?
I'm just sick. I'm tired of this. This is what I'm doing to myself. It was kind of a motivator, like, you know, this is what you're doing. This is why you're using. This is the end result.
That sounds like logic to me, and Dr. Sullivan saying that there is no logic.
There wasn't for a while. Yeah. The logic escaped me for years. It started to come back one day when, in the windows of opportunity, I just caught it, the right wave, and I realized I was just sick and tired of being sick and tired, and I toughed it out that time. The second time I wasn't so lucky. I needed help. I'm still on methadone treatment. The VA has helped me through that. Lynn Dion has helped me through that. And it's worked this time. Different strokes for different folks. It really is true that way. So today I'm clean because of methadone and because of my choice to get clean. Back then it was just a different time, different choice at that point for me.
Okay. Joe has a question with an audience member.
I see there's somebody anxious who wants to be a part of this conversation. Your name and your question.
My name is Jen Palo. I'm a person in long-term recovery. Medication-assisted recovery, the Suboxone and methadone that you speak of, I know that it is an evidence-based practice. It's the gold standard. How do you see us addressing the stigma with this treatment that saves lives?
Who would like to answer that? Okay. Dr. Sullivan?
First of all, congratulations to you on your recovery, and thank you for that very important and timely question. Many people feel that the use of medication-assisted treatment is basically substituting one drug for another. And by way of that, early in recovery, people flee from the idea of this type of medication. The difference is medication-assisted treatment is that's supervised and prescribed by a physician. And also, methadone and Suboxone work very differently at the opiate receptor compared to an opiate medication or heroin. They are long-acting. You don't see the same consequence in terms of euphoria. Suboxone especially, because it is a medication that also has the naloxone that actually blocks the opiate from that euphoric effect. So it limits the potential for misuse. And data shows that people who are on medication-assisted treatment in the context of counseling, in the context of peer recovery guidance, in the context of every avenue that we can define as treatment right now, are those individuals who are successful in decreasing the dependence on these opiates, successful on decreasing illicit behaviors that contribute, successful in just managing their life and having an experience that they were without for a very long time. So I'm really hoping that listeners will not use a stigma against these treatments that potentially could not only save their life, but give their life back.
Dr. Sullivan, thank you. As we wrap up this part of the discussion, we'd like to take a moment now and talk about the resources that are out there for anyone who needs help or anyone who wants to help a loved one. Christina has more on that.
Thanks, John. All evening, you've been seeing some of that resource information at the bottom of your screen. Our panelists have also talked about some other options, and now we want to point you in the direction of even more still. There are a growing number of recovery centers out there. If you'd like to find a center that's near you, or if you'd like more information about outreach efforts and the organizations represented here tonight, just log on to our website, abc6.com, and click on the Addiction Hitting Home link. We have the whole list of resources right there for you. And again, you can also call the numbers you've been seeing at the bottom of your screen at any time. John?
Thank you, Christina. As we wrap up here tonight, we talk to our last panelist. I want to let everybody know we have a new panelist joining us. Her name is Sophia Arnone. She's from the South Kingstown Partnership Prevention. Sophia, thank you for joining us tonight. As we wrap up this discussion on opioid addiction, I'd like to talk to the folks at home about prevention. Maybe we can prevent some of this from happening. We don't have the discussions that we're having about, and that is the solution that we're all looking for. Paul, I was curious to your thoughts on this. As you think about it, and you strike me as a deep thinker, and I can say that in the most sincere form.
Of course.
If you had a magic wand, you say, we're going to prevent it this way, how would you prevent it?
Oof. Getting education towards the kids. The younger the ages, I mean, that's...
You think they'll listen, though? Like if you're talking to some 6th grader, 7th grader, and they're just shutting out, looking at the phone, whatever.
Yeah, it's hard. I mean, you get, no offense, guys, but you get the suits. You're coming at them with figures and numbers and fentanyl and all this stuff. It's hard for them to comprehend what you're trying to say. So coming from me or Josh, or people who've been through what I've been through or can relate, I think that's a better angle than coming at them with a police officer in a uniform or telling them scary facts. People do drugs for a reason. You're gonna be in that situation. It's gonna happen. You're not bad if you take them. You're not bad if you get addicted to them. We try to scare kids so much, with so much pressure on kids anyways nowadays, that we're going at it the wrong way. And I think letting them know that it's okay to fail, it's okay to mess up. Drugs are bad, but there's better ways for you to deal with things. It's just, I think education at a younger age, from their point of view and not from an authoritative point of view, is a better way.
Sophia, what would you say about that as a student?
I do agree with what he's saying. He actually has come into our school and showed us a documentary called Chasing the Dragon, which did have a big impact on our school and all the students, and it showed us more about what substance abuse is what is happening and how to prevent it and stuff like that.
So it did have an impact?
It did.
In what way?
I'm a part of a coalition at my school called South Kingstown Partnership for Prevention, and it's also Ripple. And we had more attendees start coming to our coalition meetings every other Wednesday morning before school. So they started to see what the effects were and how to try and prevent them, so they started to come.
All right, well, there you go, Paul. Should make you feel good. Joe has another question from an audience member. Joe.
Eva Mancuso, you have a career in law enforcement as an assistant attorney general. You're a trial attorney. Your father was a state police captain, heading up detectives. He's been a police chief. But right now, you're embarking on something. You're going after where the billions of dollars have been made by the manufacturers. Tell us what you're doing.
I'm pleased to tell you, as of this taping, that I represent 25 cities and towns in the state of Rhode Island as local counsel against the opioid distributors and manufacturers for what they caused. I'm angry right now listening to this panel and sitting here. And I was angry when I saw the ABC News reports about what's happening in our state. This is our state. We love it here. And we do need to start education. We need to start educating kids in the 5th and 6th grades, in the middle schools, to realize that the drugs in mom and dad's closet are just as dangerous as the drugs on the street. But the question that I have, Mayor, for your panel is, and this is where I get angry sitting here, because I know the numbers. I know that in 2016, the 3 big distributors made $460 billion in 1 year. And I want to know what that would do to our treatment, to our outreach, to our education in our state of Rhode Island if we could provide that. Just 1 year of what they made, doing what they weren't supposed to be doing.
Start with Tom Codere.
Sure. Well, clearly that would be a game changer. Having those kinds of resources would really help us be able to fund the entire continuum. And we know from listening to the panelists tonight, that we need prevention, we need intervention, we need treatment, and we need recovery support services because that's what really is going to work. We can't just do treatment. We can't treat our way out of this problem. We have to recover our way out of this problem. So one of the things that we need to do is make sure we fund the entire continuum of care.
Briefly, Dr. Sullivan, suing the companies, good idea?
I think engaging the companies in this very serious conversation is a very important one. The United States leads the charge in writing opiate prescriptions. 80% of the world use of opiate prescription is the United States. 289 million prescriptions were written in the United States in the year 2016, and 100 million people use those prescriptions. So one would have to sit back and ask the question, is this too much use? The answer is yes. So education and prevention. Education and prevention at every junction of what we're talking about. Prevention to start, prevention to stop the next overdose is critically important. Educating physicians in the state has provided tremendous guidance for practitioners in the last year. Fewer patients, fewer pills, less of a dose, because I also want to mention that opiates still have a place in medical treatment for individuals who are suffering from chronic pain, individuals who are suffering from cancer, where this is the only medication that can help the suffering for that individual. So opiates are helpful. We practitioners have to guide the prescriptions to that individual who will be helped by that. And I think the conversation with pharma is going to be very, very helpful for individuals and for our community.
Dr. Sullivan, thank you. Let's get one last question from Christina.
John, our last social media question comes from John Hyde of Providence. He asks, how far would removing the IMD exclusion go in terms of providing care and shelter for opioid abusers? Now, for our viewers, the IMD exclusion is a decades-old restriction on Medicaid money going to mental health institutions. President Trump has spoken about rolling back this exclusion. So once again, the question, how far would removing the IMD exclusion go in terms of providing care and shelter for opioid abusers?
Dr. Sullivan, could you answer?
So IMD, again, is defined by Institutions for Mental Disease. It's a definition that was used in the early 60s to define a psychiatric facility. Back then, the exclusion for IMD really referred to the exclusion of those facilities receiving federal funds for the treatment of patients, with the thinking that in the 60s, most of those patients would be treated in state facilities that would be receiving federal funds. Well, we all clearly know that since 1960, the landscape of healthcare provision has changed dramatically, and especially when it comes to mental health. Our state facilities now are not pointed to treat individuals in acute care settings. So with that, we have a very large psychiatric hospital in Providence, Butler Hospital. We have 172 beds. 29 of those beds, we can treat Medicaid patients because of our affiliation with a medical hospital, Kent Hospital. But that leaves 143 beds that are outside of the reach of individuals with Medicaid funding. So to answer the question, yes, that would be a big impact on patients being able to access care.
All right. Thank you, Dr. Sullivan. And on that note, we'll end it there. I'd like to thank all of our panelists tonight for joining us. I'd also like to thank all of our supporters who have made this possible. Certainly Johnson & Wales for allowing us to use this fantastic facility tonight. And again, and we can't say this enough, if you would like to see any part of our opioid series, or if you'd like to learn more about the resources that are out there, just log on to our website at abc6.com. Again, it's right at the top of the homepage. You can't miss it. The opioid series, the opioid addiction crisis, addiction hitting home. We've been working on it for 2 weeks. It really has been an eye-opening experience for me.
Absolutely. I know that I 100% learned quite a bit about this addiction and really the amount of people and the types of people that are struggling with this and just the scope, how it really spreads across southern New England.
And quite frankly, the young people are the ones that know how to fix this better than anybody, because they're in the middle of it every single day. So hats off to them.
We'll end it there. Thank you so much for watching. Goodbye.